Welcome to Beyond the Badge. I'm Middlesex Sheriff Peter Koutoujian. Today I'm honored to be joined by two guests who are not only leaders here in Middlesex County, but who are among the most effective and innovative law enforcement leaders in the country. Across the nation, law enforcement and legislative leaders are seeking ways to reform the criminal justice system, improving community relations, and implementing collaborative approaches to address many of the issues which contribute to crime. The two men joining me today, along with the men and women in their departments, are laying paths for others to follow. Fred Ryan has been the Chief of Police in Arlington since 1999. This past fall, he was appointed to the Board of Directors for Communities for Restorative Justice. He's also a lead author of the Innovative Mutual Aid Agreement for Middlesex County and has been at the forefront of attempting to address the opioid epidemic right here in the Commonwealth of Massachusetts. Robert Haas has been the Cambridge Police Commissioner since 2007. Over the course of his career, Commissioner Haas has held positions in municipal police departments both here in Massachusetts and in New Jersey. Prior to taking the helm in Cambridge, he served 4 years as the Secretary of the Executive Office of Public Safety, where he focused on encouraging police responsiveness to community needs. Gentlemen, thank you for joining me here today. Let's get right into our discussion.
Thank you, Sheriff.
You have had long and distinguished careers, as I've mentioned. Can you tell me a little bit about how you have seen policing change and evolve over the years in your leadership?
Well, policing has always been kind of the forefront in terms of community action, things like that. When I started, we were just talking about community policing for the very first time. So community policing has been in place now for 2 or 3 decades, but it really was in its infancy when I first started. So there were a lot of growing pains. Really, we were trying to figure out the best way to go and things like that. I think, fast forward, if you look at today, we're probably at a major crossroads in law enforcement, which is, I think, encouraging and also challenging for us as professionals.
Yeah. How about you, Fred?
I would just add that we've become far more transparent. Municipal law enforcement agencies used to go about their mission, and there was really this us versus them relationship in many communities. With the evolution of community policing and the leadership among many chiefs throughout the county in becoming more transparent, and with transparency breeds self-correcting behavior.
Right.
So as organizations expose their underbelly to the community, it triggers a process of improvement and constant striving for excellence.
It's a constant evolution. It reminds me of the days back in the 80s when society felt like we could incarcerate our way out of crime and drug addiction and things like that. And it seems like the police departments, especially here in Middlesex County, but really more and more so across this nation, are really understanding that you can't incarcerate your way out of crime. You need to deal with it in different ways.
Right. I think we talked a lot about the war on crime, the war on drugs, and everything was determined in terms of some type of war. And we had this notion that somehow we were warriors. And
right.
Now we're getting into this whole discussion about guardians. And really, aren't the police more in terms of doing different kinds of social services work, as opposed to particularly being law enforcement officers and being warriors fighting crimes? Mm-hmm. And as you said, Sheriff, the whole notion of war just is a bad acronym to use, and it really doesn't talk about how we get out of some of these issues.
I remember I was part of a group we'll talk about in a moment, but Chief Beck from LA, who actually stayed in Los Angeles for his entire career, actually, which is unusual in a department that size. Seems that so many times they get someone from outside the department to come in. He rose through that department, and he said something during one of our conferences as we were about to go to the White House, and he said, how can you expect to work with your community if you're always at war with your community? And I thought that was a pretty sage comment.
Right. And I think a perfect example of that, following up on the Commissioner's comments, is the opiate epidemic that we're in. And many communities now really, after engaging their stakeholders and members of the community, are learning that the community doesn't want those suffering from substance use disorders criminally prosecuted.
Right.
They want them diverted. It's a public health crisis. Let's get them into the healthcare system and to the services that they need. But more importantly, there's an opportunity here. We're in the midst of a crisis, and law enforcement leaders can act as leaders and build trusting relationships. Pardon me, and enhance the trust that they hold within the community that they serve.
Right. They don't have to be that knee-jerk, just crime, like justice. It's really what you said, Chief, it's about diversion. I mean, I think law enforcement is understanding more and more that addiction is a mental disease. It's not just a criminal behavior. Right. And I know that in our shop we have some amazing programs in the Middlesex Sheriff's Office, getting some national renown, but you shouldn't have to come to jail to get those programs. And in fact, when you're going to jail, your recidivism tends to go up at least slightly, for the low-risk offenders. For the high-risk offenders, you can bring recidivism rates down, but for the low-risk offenders, it can go up.
Right.
And that's what we're trying to divert those people out before we have to pay $50,000 a year to house them.
Right. And I think this whole notion of diversion is an important piece. I mean, we've embarked in terms of working with families and youth. We understand that a lot of kids get themselves in risky behaviors, and rather than waiting for them to commit an offense, really trying to intervene earlier. So as the Chief indicated, we were much more engaged in the social aspects of policing, and I think that's kind of the trend we're moving, that's the direction we're moving, and we're moving away from this whole notion that we're strictly law enforcement officers enforcing the laws in the community.
Even when we are engaging in our law enforcement duties, recently I was briefed on a drug trafficking investigation, federal investigation. Got a very detailed briefing from folks from the DEA, U.S. Attorney's Office, and my staff on a tactical and operations plan. And I asked two very simple questions at the end. It was a heroin distribution case. Asked two very simple questions at the end of the briefing. One, do we know the identities of those purchasing their drugs from this dealer? The answer was yes. Follow-up question, what are we doing to get these people some social services? Because there's an opportunity here.
Right.
We are unwittingly creating a public health crisis in our community the very next day because we just took a supply out of the equation.
Right.
So it's a perfect opportunity now to inject some public health services, and so I've left with my people, moving forward, I don't ever want another briefing like that unless it has a parallel social services
And you
plan
can get
to
them
go with.
supports that they need. I remember when I was a prosecutor a number of years ago, and that would be the opportunity that police would take to actually call in the buyers, the addicts, so you can make more arrests. And I remember very specifically, they would make a bust, they would make an arrest in an apartment or a house, and then they continue to answer the phone and collect more people to come in and make more arrests, which was a sign of success back then. And we're in a very different world right now. Now we're reaching out to provide them services.
Right. And I think to illustrate that, I think one of the things that turns this thing upside down is we're now calling high-risk offenders in and saying we're offering you a different pathway.
Right.
You're going through this cycle where you go out, harm the community, get arrested, come back to the community, re-engage in social harm. We want to help you find a way that you can reintegrate back in the community and be productive citizens. So it's this whole notion of turning everything upside down in terms of what our role is in terms of policing.
Listen, being in jail is not a fulfilling, life. And sadly, so many of the men and the women in my operation, they cycle through our operation. Our officers get to know them. Sadly, almost as family members. That black sheep of the family that come back and forth and back and forth all the time, and yet. No one as a child would ever say, someday when I grow up, I want to be in jail, or ever dream that they would be back and forth in jail. And a lot of that is also, as you already mentioned, the community relations, and not just community policing, but community relations, and changing that dynamic. And I know both of you have been very active in working with your community on these type of relations. I think Massachusetts has been on the forefront as well.
It is. I think what we're seeing now in terms of the wake of Ferguson and Long Island or Staten Island and the other places around the country where we've had these unfortunate instances, New England and particularly Massachusetts has been leading the pathway in terms of where policing needs to go. You're not seeing those kinds of incidents taking place with any great deal of regularity. And I think because the police chiefs, especially in Massachusetts, have been very progressive in terms of thinking about that role change and thinking about where we're going. But it's about building communities of trust, and all communities within your community of trust. And I think that's where you see some of these situations where there are segments of the community that feel like they've been disenfranchised, no longer part of the main community, and actually the subject of police enforcement. I think policing in many respects was thinking they were doing the right thing by suppressing crime, right? Well, but suppressing crime, the tactics we used basically suppressed the whole community, and they felt they were being alienated and the target of that kind of suppression activity. And you don't see that taking place in our communities.
Right, and in addition, the partnerships, with the Middlesex Sheriff's Office, for example, the reentry, and I know that you're very active in getting your detainees up on Vivitrol before they reenter the community, and so those partnerships, not only across municipal jurisdictional lines, but state, federal, municipal, really all rowing the canoe in the same direction. To leverage the resources that are out there to make our community safe.
Well, and that's a really great segue into what I was hoping to speak about next, is the collaboration between not just your departments, but our office as well. We're doing a lot of that recently, and I'm really proud of that work, because I always found that as the sheriff of a large county, 54 cities and towns of 1.5 million people, that I could lend some of that regional law enforcement support to local police departments while not stepping on toes, but to work collaboratively. And one is the gun buyback that I know that Cambridge has had one, and Arlington has had one that we've worked on together. I think Arlington was one of our first ones, and could you tell us a little bit about that experience, Fred?
Yeah, we worked with our interfaith community to roll out a gun buyback program, and in retrospect, we called it a gun buyback. I've been talking with Commissioner Haas about what we're planning for the future, but it's really a safe homes approach, because in a community such as Arlington, we're not taking crime guns off the street.
Right.
We're taking surplus firearms that might otherwise be unsecure, left where somebody could have access to them, and getting them out of the home. What we found with our gun buyback was a lot of the firearms were legacy firearms. A grandfather, great grandfather passed away, left them to family, and they just didn't know what to do with them.
Right.
So we gave them, it's like the community hazardous waste day. You bring your hazardous waste, well, bring your dangerous firearms, and we'll dispose of them.
And how many did you get in your first Safe Homes initiative?
Well, we worked in partnership with the Middlesex Sheriff's Office, and you had staff there to assist our staff, and we took in 80 firearms at the site that your team was able to manage for us, and then about another 24 came in to the lobby in the subsequent week. So over 100 firearms were taken out of homes.
And do you think people were taking it, because we say the gun buyback, we provide a card or some kind of certificate, but what do you think? You think they come in for the money?
No, I think the major thrust, and I think goes back to what you talked about, Sheriff, and I guess this initiative is unique in the sense that now we're doing a regional collaboration.
Right.
So it's Arlington, Somerville, Watertown, Belmont, and all in collaboration with the Sheriff's Department to really emphasize the fact that we all want safer homes and safer communities. So when Chief Ryan talks about the hazardous waste days and things like that, it's more of a public health message. And I think the benefit of this whole initiative is really raising public awareness and getting people to understand that the guns do in fact pose a liability, and here's an opportunity to do something and training back. The thing that's unique that we're doing too is we're actually offering kids to bring in their toy guns and getting gifts for it too, because I think that message is so important.
I think that's a great message.
Right.
I mean, and we're speaking about guns that are unwanted in their home, that people just don't know what to do with them. They're not sure how to dispose of them or where to bring them. We're speaking about a record of it's about 19,000 suicides a year in this country, 4,000 uncompleted, we don't say unsuccessful suicides, and 11,000 homicides and 16,000 unintentional shootings. So it's really getting a weapon out of the house that people don't want in the house.
Right.
So I think, and I applaud you for taking leadership on this, because I think as we had our meeting recently, and by the way, people that are watching for this initiative should really be taking a look for their towns, because some of the towns will accept guns from some of the weapons from other communities. But I'm hoping we can add a couple of on. I'm going to reach out to a couple of chiefs soon to see if we can add them into the regional, as long as we can manage that as well, because I know there are a couple that would probably join in. And it's a way to build communities, as you were saying. It's the faith community has been involved. I think in Arlington, I know in Cambridge as well. Yeah. I think in Cambridge you used the drop-off site was actually in a faith community site.
Exactly. We used two religious houses of worship to actually be the sites again, because the message really isn't trying to figure out where these guns came from. It's to get them off the street and properly dispose of them.
Right.
But again, it's a collaboration, like Chief Ryan talked about, in terms of the whole community being involved in. It's not just a police initiative.
Right. So thank you for your leadership on that as well. And again, for people to watch for their announcements in their local communities to see when these gun returns will be, and when we're talking about doing them over a couple of weeks, actually. So it's not just one few-hour window that you have, and maybe again being able to step over a municipal line to be able to return your weapon as well. Another collaborative effort we've been working on, Chief Ryan, maybe you can tell us a little bit about the regional lockup, something I know that when I first became sheriff, every one of the chiefs in Middlesex County, all 54, signed on to a letter. It was the very first request that I had as sheriff when I said, what can I do for you? It was the idea of a regional lockup. Can you tell us a little bit about what that is?
Yeah, sure, and thank you for working with the municipalities on that. Essentially, it had become abundantly clear to many chiefs in Middlesex County that we were detaining people that had been arrested pre-arraignment, pre-conviction, in worse conditions in municipal lockups than they're being held when they're after they're convicted of a crime. So, for example, somebody gets arrested on a Friday night in Arlington for an offense that they're not eligible for bail for. We're putting them into a police cell block, which is designed and architecturally designed to be temporary holding cell. And on a long weekend, they're there, through Tuesday morning. No exercise, limited meals. And so
Limited health care and mental health attendance too, which is a significant issue now.
The intake process that municipal police officers have the capacity to perform is limited at best. And so we started to look at regional lockup models around the country, and it quickly became very clear to us that the sheriff's office has that capacity to screen in a detainee, do a proper mental health evaluation, medical evaluation, and substance abuse evaluation, and to be able to detain them in a far more dignified way, particularly overnight or over a long weekend. So we're working with the Commonwealth of Massachusetts Division of Capital Asset Management. We've retained a consultant to help us study, how this would be implemented in the county, and we're excited about it. We think that members of Middlesex County want their detainees detained in a dignified way, and we've heard that.
Yep. And you take in more than Arlington might, but you still,
just to take exception with Chief Ryan, our facility is not decrepit. So but even saying that, I think the points you make are extremely valid. I mean, we're seeing our population becoming much sicker, right? And without exception, we're making regular transports to the hospital.
Right.
And I think it's just a matter of the time that we're basically maintaining prisoners marginally while they're staying over a long weekend. But I think the Sheriff's Department, because of the work that you're doing, this is your expertise,
right.
that you can provide a much better level of service to our detainees, and making sure that they get the health care and things that they need. And it's a population that's changing dramatically in terms of needs, and we're not that well equipped to deal with those kinds of issues.
And aside from the facilities themselves, and some are better and some are worse, the fact is that that's not what police officers are trained, nor what they should be doing. They should be out on the street protecting communities, and that's what corrections officers do every day. We deal with these men and with these women in a way we're able to screen them. I mean, listen, for our intakes, about 46% have a history of mental health issues. 35% are being treated for some mental health issues while incarcerated. We're actually detoxing almost half of our population. 43% of our new admissions have to be detoxed. The predominance for opioids, but otherwise alcohol and polysubstance abuses, and about 20% only for opioids themselves. This is what we do. And I remember, I don't know if you were there, Chief Ryan, when we brought in a number of chiefs of police come in to take a look at the facility in our facility where we book and bring them on in, classify. It was just watching the chief's eyes open up to see our guys. That's what we do. We're the experts in there, and police shouldn't have to be the experts in that type of way.
And it's a scale of economies. Let's face it. I mean, every police department's maintaining its own detention facility. That means there's personnel that's staffing it. And again, I think you can do it much more economically and much more efficient than we can.
Right.
Yeah, and the value-added benefit is, if we can transfer, particularly those high-risk detainees, we free up a police officer.
Right.
So it's redeployment of existing resources back out into the field to do some community policing.
And as one chief has said in Middlesex County, with the liability and the problems of having just one bad case and lawsuit and meritorious lawsuit, and sometimes that can happen anywhere, but that's just one can set a town really far back.
Right.
So it's best that we kind of take it as the experts, and that's what we do. So I wanted to speak a little bit about, we spoke a little bit about diversion. I know both of you are doing some diversion programs. Chief Ryan, are you dealing more with, you have a mental health program out there. Do you each have a mental health diversion program out there? Can you tell us a little bit about what that does and how it works?
Sure. So we've been working with the mental health population. Again, we're seeing a situation where we have broken systems, and we're finding more and more the police are responding to critical calls where the people are suffering from mental illness. We've been fortunate in Cambridge. We now have 2 licensed social workers on staff. That just shows the direction where we're going. But we actually have officers that are dedicated to doing the wraparound services. So when somebody goes into the hospital, gets stabilized, and come back in the community, our goal is to improve their quality of life and make sure that those services are wrapped around, because typically that's not what's happening now. I mean, they'll come back in the community, and what the traditional response is, wait for them to go back in crisis, police go back. And every time that cycle goes on, it gets more and more dangerous, not just for the person, but for the police officer responding. So we're trying to figure out how we really have an impact in terms of people's lives. We actually garner those kinds of services, and we actually get people so they can integrate in the community and feel safer.
Right. What about you?
Yeah, so we have 1 full-time clinician on staff, and really, I'm entering my 31st, 32nd year in law enforcement. One of the things I'm most proud of being involved with programmatically with our team was the implementation of a full-time co-responder in the police department. You know, we evaluated a lot of our cases where we were responding to somebody in crisis, and police officers only had so many tools in their tool belt, and so we were, you know, arresting people for minor criminal offenses when they were in a mental health crisis.
Right.
You know, so now with a co-responder model, once the situation stabilized, the clinician responds in the field and begins to provide other alternatives to arrest to get the person into the proper setting and as the commissioner said, really long-term addressing the situation long-term, because we were finding we're going back to the same addresses of the same locations over and over again. So now we're looking at intervention services and social services to try to prevent that moving forward. It's a wonderful program. We're treating people the way they ought to be treated rather than running them through the criminal justice system.
So you said before with regional lockup, and I remember you said it in a hearing, with dignity. That's they should deserve to be treated with dignity.
Yep.
And the fact is that, you know, I remember there was a program part of law enforcement leaders, which I'll speak about in a moment, but there was a program in, I think it was Miami, where they actually had about 10,000 mental health engagements on the street with police officers and licensed clinical social workers. And I think in all 10,000, they had to, in the end, they had to make 9 arrests out of that. So imagine all those people that are in a mental health crisis that shouldn't be in jail in the first place. It's only going to exacerbate a problem, now being diverted out of the system and getting hopefully the services that they need, which is really what they should be getting to.
Right.
So, and as part of that, I was part of the law enforcement leaders to reduce crime and incarceration, because it can both be done at the same time. And that's where I met with Chief Beck and Bill Bratton, and it was just so many, Kathleen O'Toole. There were national leaders from around this country, law enforcement, that were speaking about reducing crime and incarceration, dealing with the issues of addiction and mental health, in ways that we can divert people before they have to get involved and lower recidivism rates at the same time. And this is where I became familiar with the term, because at the time was many of the hotbeds of Baltimore and Ferguson were going on, Chief, and became familiar with the issue of procedural justice. And I know that Cambridge has been dealing with the issue of procedural justice. I really find it fascinating. It's not just community policing, it's procedural justice, it's a perception.
Right, so there's a fundamental shift that takes place when we talk about where police officers derive their authority. Traditionally, we always thought about our authority coming from the statutes. We derive our legal authority to make arrests, detain people, and the worst case scenario is actually have to use force and deadly force. What we really believe, and I think this is where you're seeing the shift come in, is you really derive your authority from the public. Public trust, the public believing that you're doing things for right and honest reasons, and it really makes the situation much safer for officers. If you think about it, it's almost counterintuitive, where officers have those skills, and as Chief Ryan talked about, those tools in their toolbox. But we're very narrow in terms of our approach, and we're broadening our response and really looking at the fact that we're social agents within the community, that we really are trying to improve the overall life for all facets of the community. And this whole notion of procedural justice is really about people feeling that they're being treated fairly, they have a voice, and that the police truly are being transparent, as Chief Ryan started this conversation before. So it sounds, in some respects, being semantic, but it's a fundamental shift in terms of the way we think about policing and how we do our authority. So all these things that come out about mental health, vulnerable populations, are all part of the police legitimacy role that we're greatly expanding our role within the community, and it's consistent with what we're doing. So this notion of procedural justice is, I think, the thing that I think chiefs are grappling with this across the country. I think in Massachusetts we've operationalized that whole concept, so I think it's beyond the concept right now, and it's actually in practice in many of our communities.
It seems that it's almost more the fact that whether people are actually being treated fairly or unfairly, it's the perception of how they're being treated. And in Ferguson, that was exacerbated by the fact that the minority community was being sort of taxed more than others they were being hit with much of the citations and the fines, and this was driving up the fact that they just didn't feel that there was procedural justice. They weren't being treated fairly. And again, you can be treated fairly or not, but if you don't perceive you're being treated fairly, and maybe there's not those community relations where they can be reassured, then they're simply not going to participate.
And we're only as good as the trust that the community places in us. As the commissioner said, we can have the statutes that empower us to do our job, but without the trust of the community, those statutes are worthless.
That's right. And Chief Ryan, I know you've been involved with Communities for Restorative Justice. which is another newer initiative and something really special going on. It was starting with some of the victims' rights community, and now has stepped into the law enforcement community. Can you tell us a little bit about what restorative justice
so
is?
restorative justice is an alternative to the traditional criminal justice system. And in the traditional system, a victim of a crime, let's say a property crime, your home is vandalized, and the police identify the perpetrator, seek a criminal complaint, it then becomes the Commonwealth's case. And the case gets prosecuted, and you are but a witness in the Commonwealth's case. Restorative justice turns that on its head.
It really disempowers victims in many ways, because you're just a victim. You are a victim, but you're just really a witness in the case itself.
Absolutely, it's the Commonwealth's case. In the restorative justice setting, the victim plays a critical role in what's known as the opening circle, where an offender has to admit to their wrongdoing and be willing to accept responsibility for the harm that they've caused. And it's until I sat through my first opening circle, this was all very philosophical.
Right.
But to see it unfold, a victim in a room with a perpetrator, and the perpetrator having to explain why he or she did what they did, and to have the victim communicate with the offender and tell the offender how the harm impacted them and their family and their loved ones. Incredibly powerful experience. One I had very early on, I was involved with, a young man vandalized a mom and pop shop. And the mom and pop shop had to close down to repair the damages, lost a half a day of business. The opening circle, the program was in its infancy, looked like it was going to go south real fast because the victim was really angry at the offender.
Right.
And shouting at the offender and so forth. The young man accepted responsibility. A contract was formed, a restorative contract. Over 90 days, the young man, not only repaid the financial loss to the victim, but there were other community service and had to write a letter, a reflection letter about what he learned during the process. At the end of this process, that business owner wound up hiring this young man to work summers in his mom and pop shop while he was in college.
Now
the alternative would have been a felony Corey for this young man,
right.
or a lifetime friendship and respect. It's fascinating.
Well, you think about Massachusetts being on the cutting edge, and we've just got to wrap up now, but Massachusetts being on the cutting edge with allowing victims to address the perpetrator in court for sentencing purposes, but that's really just for sentencing. It's not for making them whole or perhaps bringing the defendant back along in some ways too. That's a pretty amazing story. I love that story. Well, thank you very much, Chief Ryan and Chief Haas, for joining me today. I hope you find this discussion as informative as I did. Thanks to all of you for joining us in this episode of Beyond the Badge. I hope you'll tune in for future episodes, but until then, remember, life is full of choices. Please make good ones.
They said I couldn't dream. Called me a piece of trash and swore that's all I'd ever be. Said a bottle couldn't see the ocean. Give up. Go back to the dumpster. But I didn't listen. I made my way. And now, I am what I've always wanted to be.
So good to see you guys. So, what's up?
Oh, we finally bought a place.
Holy cow.
You seriously have enough saved to do that?
We've been putting a little aside each month.
Jeez, at the end of the month, we have nothing left to save.
Yeah, I have no idea where it goes.
Well, you're spending a lot on...
Was it good?
Oh, God.
Oh, how is my account overdrawn?
When it comes to financial stability, don't get left behind. Get tools and tips for saving at feedthepig.org.